So I'm looking at my Facebook page for when we go.
There we go. Okay.
Oh,
so
yeah.
I think we're live.
I don't know.
Hello?
Oh no, it says this video should start soon. Oh, now we're live.
Oh.
I think we're here. Awesome. Hello,
it's a good
everyone.
thing someone told us. So just so the audience knows, we can only see each other.
Yes, we can. And for everyone out there, please breathe through this with us. This is our first live video stream that we have conducted. So hopefully you find it informative, and we're happy to be here to answer your questions. I'm Kevin Morrison. I'm the Cook County Commissioner representing the 15th District. First and foremost, I recognize we're in unprecedented times, and that's why I feel like it's so critical to have leaders here in the community be able to not only share resources and information to the public, not only about best practices, but also how we are here to be able to help you at this time of need. And so first and foremost, I want to thank everyone who is here and taking some time out of their day to join us for our first virtual town hall. I hope it's incredibly informative for you. I want to share my appreciation with all of our first responders, our medical staff, everyone who is working on the front lines right now, from folks working in restaurants to our food banks and the like, everyone who is leaving their homes to help at this time of need. I want to share my utmost appreciation. It is a critical time, and I will continue not only trying to inform the district of the resources that are becoming available as they come online, to try to get the most scientific-based updates out to the public on how they can protect themselves and their families. I think it is critical, and that's why my staff has been sending out a COVID-19 newsletter every week as things continue to get updated. I hope you all know that you can comment on this live stream, and we'll be able to see your questions once we get to the question and answer portion of this. But without further ado, I'm going to introduce and thank you so much, State Representative Michelle Mussman, for joining us and being able to lend a perspective from here in Illinois. So thank you, and I'll let you share some of the information going on about some of the initiatives at the state level.
All right. Well, thank you. Thank you to everyone. I'm really grateful to be here with you today. I'm actually in between shifts at the Schaumburg barn, borrowing someone else's office. We are packing to distribute over 300 packages of shelf-stable goods and fresh vegetables to our seniors in the community today. And I want to thank all my fellow volunteers who have been out. It's been amazing. My husband and son were here. And I also want to thank everybody else in the community who's been working on the food insecurity issue. Joe Podlasek over at the Trickster Cultural Center is actually packing groceries right now. He's sending dinners over to some of our shut-in veterans. I want to give a shout out to Natalia Nieves with the Rolling Meadows Police Department, who's also been putting together food pantries for her community. All of the townships have been really rock stars in trying to make sure that everybody's immediate, at least food needs, are being met and beyond. So many people to thank. And thank you to Kevin Morrison and his team for helping us put together this new way of talking to you. It is strange to be talking out loud and not be able to see anyone, so bear with us. I did plan to have 5 town halls throughout the spring, but obviously that's changed a little bit. So maybe this venue will kind of give us that new opportunity to talk. First off, I do want to remind everyone that my local office is here for you, but we have moved. We are now at 11 North Roselle Road in Schaumburg, which is on the northeast corner of Roselle and Schaumburg Roads. We are a diagonal to the clock tower. I've not figured out the best way to explain where we are, but we are nearby. Come find us. The office actually isn't open for drop-in visitors, but my assistant Christy Wessel and I are still hard at work. We are largely working remotely, but we check messages every day. So if you need anything, if you have questions, if you have opinions, please feel free to call us. The number did not change. It is 847-923-9104. You can email me at staterepmussman@gmail.com. Please remember that a great many of our government functions, like renewing your license plate or applying for SNAP, applying for unemployment, they can be done online because our state offices are not open. Yes, some of the programs have been working better than others. The scale at which people have suddenly had to start using those services has been quite beyond the traffic they were originally designed to manage. Our state employees have been working really hard to make major changes, like moving to entirely new platforms for these services. Work that should have normally taken more than a year to vet and test has occurred in 2 weeks. So there are going to definitely be bugs. We appreciate your patience. Response times are getting better. Please stick with it. If you're really having trouble, go ahead and contact my office and we'll see what we can do to help move things along if possible. As far as the work being done in the House right now, you know that session has been suspended until further notice. Our laws do not currently allow us to conduct our business or vote remotely. We'd actually have to go back to Springfield and vote to allow that to happen. And I know that many of you would happily send all of us back to Springfield, but remember, it's not us alone. We have a lot of staff and a lot of public participants that make all of that happen, and we're very concerned about unnecessarily exposing them at a dangerous time. We are working behind the scenes. There are numerous work groups. There are tons of conference calls and Zoom meetings as we try to figure out what things are most vital to get voted on, to keep everything moving so that we can get into Springfield and out of Springfield as quickly as possible. As you know, the state budget is the biggest thing that we're going to have to address when we get back to the Capitol. There's a lot of unknowns about that. The state largely gets its money from income tax and sales tax, and those are all on delay. We think it'll take quite some time before venues begin to open and spending patterns start to approach normal again. To build our budget, we have to start with an estimated amount of revenue that we believe we would bring in throughout the entire upcoming year and compare that with the budgets proposed by the agencies based on the work that they are statutorily obligated to perform in that upcoming year. But with the losses and delays to our revenue collection, it means it's really hard for us to accurately predict how much money we will be able to bring in. And it's also going to be really hard for our agencies to predict the number of people that they're going to be helping and what they're actually going to need to be doing to serve those people in order for them to create accurate budgets. We are also unsure of how much financial support we'll be getting from the federal government at this time. It's not a secret that the state has had a rocky couple of past years with our budget. We were not in a great place when this crisis has hit. There is no way that we will avoid taking on massive amounts of debt as we attempt to help our residents and keep our operations, like caring for the disabled, our seniors, our veterans, our foster kids, education, all of that needs to be kept afloat at least as good as it was, if not better, right now. I do want to remind all of us that we are in this together. All units of government collect taxes and fees from their residents in order to turn around and somehow use that money to help their residents. It is a great wheel that turns around, and we need each other for these systems to run. And it's going to feel even more painful than usual for people as they've seen their own financial security shaken. Their jobs are lost, their hours are cut, their expenses are rising. They are naturally going to want to hold on to every penny they can and be cautious and cynical about how every penny their government asks them to give them, especially if you are a person who does not currently get a lot of support for the government. You will be even more cynical about how much is collected from you and whether or not it's being spent on people and programs that you feel are worthy of your money. We will be dealing with the consequences of this crisis for many, many years to come. We've lost revenue, we've lost savings, we've lost education time. There is a great physical and mental trauma really for all of us in some way. While on one hand, for your own mental health, I do encourage you to pace how much of the stressful information you are taking in and dwelling on. But at the same time, I also think it is very vital that we think hard about the complexities of our shared society, how we all rely on one another, the role of government in our lives, or the differing views about how much role government should play in our lives. All of these programs that help us in various ways, how they are paid for, how we're going to choose to care for each other going forward. That being said, I think it's a good time to open it back up to Commissioner Morrison and open it back up to questions so that we know we're talking about the things that are top of mind for you right now. And thank you for allowing us to talk.
Thank you, Representative Mussman. That was very helpful and informative. I really appreciate it. First and foremost, I do want to just stress some of the guidance and guidelines that are being promoted by our public health officials. I hope that everyone continues to follow. Ooh, we got
that. Hold on, I'm going to mute myself.
It's all right. Well, I just wanted to say I hope that everyone continues to follow the state stay-at-home orders. The more time that we stay home, the less stress that we're going to be putting on our healthcare systems and the less opportunity we will to transfer this virus to others. And so I hope that people continue washing their hands frequently when they do have to leave the house and go to a vital service such as a grocery store. Make sure you're washing your hands for 20 seconds. There are new guidance and suggestions on wearing some type of cloth face protection when you're out in public. Continue to stay 6 feet away from others. Avoid close contact with those who are ill. Cover your cough or sneeze. Cough into your elbow, sneeze into the elbow or a tissue. Avoid touching your face at all costs when you are out of your home. Once you get home and you wash your hands for over 20 seconds with soap and warm water, you can touch your face all you want, but it's incredibly important that when you're out that you do pay close attention to that. I know it's hard. Constantly clean and disinfect frequently touched surfaces. Stay home if you're feeling sick. Please reach out to your friends and family to help you with your needs if it's in terms of getting food and the like. Right now, if you do feel like you're coming down with flu-like symptoms, the first point of order is to call your primary care doctor and get suggestions from them. That's always the first case scenario, and that they can help direct you to testing if that's appropriate. There are testing centers going online at all times, so that information is continuously being shared. I think it's incredible, of course, if you have severe symptoms and you're only getting progressively more ill, of course, that's the time you call 911 and get emergency care. My office has been working remotely since early March, and we continue to try to get the best case information out there. I've been spending a lot of time on phone calls, reaching out to our food banks, reaching out to our municipal leaders and local leaders. I have a great debt of gratitude to our governor, J.B. Pritzker, to our county board president, Tony Preckwinkle, and all of our local leaders, such as Representative Mussman, but our state senators, our municipal and township leaders. Everyone is really working hard right now to try to do what is most critical, which is help promote the safety and well-being of our districts and our communities. And so I think it's important to share some of the information we've been sending. If you go to my website, it's commissionerkevinbmorrison.org. We've got information that we are constantly updating about COVID-19 resources on my website. We're also sharing that through our weekly newsletter. So I hope that you go and sign up for my newsletter. We're sending out as new resources come online, as new opportunities, new guidance comes online. We're continuously trying to get that out to the public so that you could keep your family safe and healthy. There's a lot of things Cook County has been working on. And so it's important to share that information. One of the first initiatives we did was halt sales tax dues for February and March for all of our local businesses, which is critical because at a time where we were seeing that those types of revenues go into our local businesses, it was incredibly important to find ways for them to have a little bit more revenue in their pockets. I know a lot of people continue to have questions about COVID-19 and how it's affecting our communities. I continue to try to get that information out to the public. A couple things that you can do, and you can find all this information, excuse me, on my Facebook and social media or through our newsletter. One simple way you can do this is by texting Alert Cook. That's one word, Alert Cook, to 888-777. That's one way that you can get text updates from your own home about how things are developing here in Cook County. There's a hotline that our County Public Health Department has online to answer any of your questions. You can call them at 708-633-3319, or you can email them at ccdph.covid19@cookcountyhhs.org. Now, mind you, we're going to be posting that information, so if you didn't write it down, I'm sure my staff will be entering it into the comments, so hopefully you can see that information, and we'll be making sure to continue to publicize that. There are a lot of great things that the county is trying to do right now to ensure not only the safety of county staff as we continue to work and try to provide for the residents here in Cook County. One of the programs that we did to help support our small businesses was the Cook County Recovery Fund. As part of a large recovery initiative, this fund is providing rapid relief loans up to $20,000 to small businesses and gig workers and independent contractors here in suburban Cook County. One of the reasons why that was critical, it was one of the first initiatives to come online that actually included gig workers. So I know there's a huge impact on our gig worker economy, especially, you know, if you think of things like Uber and Lyft and drivers. Those folks have been hit quite hard during this economic downturn. And so it's important that we're able to find ways to help them deal with their needs. We have placed a pause on all evictions. And so we'll be providing information if you have any landlords that are trying to forcibly evict at this time. Those are all on hold, and the sheriff will not be enforcing those. So that's incredibly important information to get out to the public. The county is making moves to waive various county fines, fees, deferring tax collection to the tune of $35 million to help ensure that folks are able to get by at this time. There's lots of programs that we are continuously unrolling. So I hope that you will not only pay attention to our social media, sign up for our newsletter, go on to our website to not only be able to be updated on resources and incentives and any type of opportunities that are being made available, just to ensure that you have all the information that as it's becoming online. I look forward to answering a lot of your questions. A lot of our county offices are working remotely right now. We've put a lot of work into allowing for telehealth communication so that folks could call in and speak to a healthcare professional at Cook County Health. There are also tons of resources for folks' mental health. I know I'll just shout out there. One of the ways that I'm keeping myself up right now is by cooking. That's one thing I enjoy doing. And so ways that you can decompress and disconnect and be able to find things that you enjoy doing from home is quite critical at this time, especially when, you know, we're all having to remain socially distant. And so we'll begin by answering some of your questions, and we'll continue providing information throughout this, and hopefully it is helpful to you all.
All right, I'm going to try and unmute myself and hope the telephone doesn't keep ringing. So it's a bit of an interruption right now, but they're busy today because actually lots of seniors are calling to confirm that their groceries are available and what time they can arrive. So again, it's a really critical service we're providing. And a shout out to Pilot Pete's, who is providing over 200 free meals to our seniors today. So thank you. A lot of restaurants in the community have really stepped up. So we are very fortunate for that.
Oh, that's incredible.
Yeah.
Well, I believe the first question we have from Marianne, I'm going to pass on to you, Michelle. It has to do with U.S. residents who went to medical school abroad and how there is any potential for them being able to help during this time.
So I would say we would want to check with the IDFPR website. They've actually been putting out a lot of postings about how they're trying to open up some of the licensing procedures to create more opportunities for people with expertise in the medical field to operate right now in times of crisis. I do not want to risk speaking out of turn and suggesting what they are actually able to do without consulting with the IDFPR first, because I found that our state rules are very complicated, and honestly, right now they're changing almost daily. You know, as we try to find ways to respond to the crisis. So I would say we will check the website first. If you need our help doing that, you know, again, call the office back, and we'll make sure that's happening if it's not clearly posted on its own. So hopefully that helps. And again, we've been very grateful. It's been amazing to see the number of healthcare professionals, even medical students, that have raised their hand and offered to come forward in some way. So we are trying to make sure that that can happen. Good.
Incredible. Thank you. Thank you for sharing that. From one of the questions that we've got in is that we have flattened the curve. People are at risk and can stay home. If businesses don't think it's okay to open, they can wait. We can practice social distancing open the state back up. We cannot wait until June. You are killing small businesses. Unfortunately, yes, we have helped start. Well, we are in a process right now of helping drop the curve here in Illinois, but unfortunately, it seems that our best case scenario was not realized, and we don't believe that the peak will occur in Illinois now till mid-May. And so, trust me, I would love for everything to be open back up. I'm getting a little bit stir crazy. I live home alone with my 2 cats, so it's been very difficult for me because I don't have anyone at, and it's been very, very distant in terms of the type of real face-to-face conversations I've been able to have. And so I recognize your concerns, and trust me, we have some of the best medical health professionals working on a strategy on how we can get there. And I know that the governor is anxious to help. I know that there will be some shifts in May in terms of some businesses that will be able to start opening back up. But as of right now, it's so incredibly important that we follow the shelter-in-place guidelines and stay at home, because unfortunately infection is still being communicated throughout our communities. And so first and foremost, I am so relieved that we have not seen a worst case scenario. I was actually listening today. Some recent information was released that had we not began our shelter in place when we did, today we have unfortunately lost over 1,600 Illinois residents to COVID-19. And the predictions were, had we not put our shelter in place when we did back in, I believe it was March 24th, or maybe March 17th. It was somewhere around those days. All my days are bleeding together, but the projections were we would have had over 30,000 deaths as of today had we not done that and taken those moves. So I know that everyone's anxious to return to some semblance of normalcy, but first and foremost, we do need to make sure that we get off that peak and we drop the curve low enough so that folks are not at risk when they start returning to work and some type of normalcy. So we'll continue updating folks on that information as it becomes public. And I definitely hear your concerns. I know I'm getting antsy myself, but right now it's so incredibly important that we don't reverse course and see our healthcare systems become overwhelmed. I think it's incredible that we have not seen that thus far, but making sure that our first responders, medical workers, officers are safe right now in the line of duty and not having to worry as much with it spreading thoroughly throughout our districts is incredibly important. And so I thank you for your patience, and we'll continue updating you as that changes. Did you have anything you wanted to add to that, Representative?
Yeah, the phone was ringing. Not in particular. I would say the one thing I would say about the businesses right now is we are finding that for even businesses that were deemed essential and had remained open, they're starting to see an influx of employees get sick. And so that is concerning. We know that if you have, a lot depends on the kind of business that you have and how your employees would have the ability to social distance while they were actually doing the work that you needed them to do. And I think that there's also concerns about access to PPE, right? We know that there have been wide shortages, and we are starting to be able to meet those in a better way, but we need to prioritize getting those into our healthcare facilities, our nursing homes, our veterans homes. And so if we have to dilute that or reduce that by trying to push some of those materials out into businesses, that's concerning also. So those are things that are complicating that. And I'm going to turn myself off now because somebody's leaving us.
No problem. This next question is quite important too. It's about testing. Kathy asked us, is testing only for those that are having symptoms? And so I know that the governor has made some recent moves. We have been working really hard here at the state of Illinois to up the amount of testing capacity day by day. I know that early on it was in the hundreds range of the ability of how many folks were able to be tested. I know today we're in the realm of over, I believe, 7,000. Maybe Representative Mussman has a better figure of how many tests are being conducted each day. I know the number is continuously growing, and I know we're trying to get over 10,000 samples tested per day. We have a long way to go, but I'm glad to see more testing opportunities go online. The governor recently made some shifts to open up and broaden the amount of folks who can get tested. If you have low symptoms or have been in close contact with someone who is tested positive, you can go in and get tested. I believe in some of these areas, they're even waiving the need to have a prescription to move forward and get testing. And so if you go to the Illinois Department of Public Health's website, it's dph.illinois.gov and then /COVID-19 /COVID-19-testing-sites. It will show you where all the testing sites in your area are located, and more testing sites are continuously going online. So as those updates come, those testing sites will be added to the website. There's also incredible guidance on the Department of Public Health's website, as well as on the Cook County Department of Public Health's website. So please continue utilizing those resources to get some information on testing sites and the like. I know we had some questions early on about antibody testing. I know that those capacities here in the state of Illinois are beginning to grow. I know that innovativecorona.com. If you go to innovativecorona.com, there is a antibody testing site as well. So if you believe that you have had and recovered from COVID-19, as I said, antibody testing is not up to the numbers that they will be, but in the coming weeks, I know as more reliable antibody testings become available, those sites will also be increasing.
Okay, so I see that someone has a question about a location like a clearinghouse for all the vast amounts of information that's coming through to us. Really, I would say the best place to go is coronavirus.illinois.gov. That is trying to be, as best it can, a clearinghouse for links to all sorts of information regarding this. Obviously, there's a lot that changes very, very locally in the state. That state website can't hope to tell you what the difference is between Elk Grove Village Township as opposed to Schaumburg Township and Palatine Township and all of those, if they're offering kind of custom answers to their community. So it is a lot of information, but yes, you just need to check all of the government agencies that you've got coming to you, because they are all trying in their own way and corner of the universe to respond to you. So yes, coronavirus.illinois.gov is an amazing clearinghouse and link, but you have to individually Google your own resources also, really, for the most up-to-date local information.
Good, very good. Now, this question I think is a state one as well. Will the proposed budget be based on current tax rate or under the assumption of the proposed fair tax amendment?
My understanding is that I would say whatever budget work is being done right now is not being based on the idea that the progressive income tax would pass. I think that would be, I'm sure that's in the back of their mind, is what scenarios could look like should it pass and if it doesn't pass. But I would think that it would be incredibly risky for any of my fellow members to be building a budget on scenarios that may not come to fruition. And I would be very hesitant about supporting budgets if I thought that they were completely built on things like that. So I would say no. I think there's been talk of making a 6-month budget, and then coming back when we know more about maybe how things are going. I think that we're going to be really cautious about the paths that we pursue, and I'd hate to say it, but I think it's very realistic to say the idea that we would be able to craft a balanced budget on paper and vote on it sometime in May or June and expect that it would remain balanced at the end of that year with so many things changing is just not realistic. I don't think it's humanly possible for anyone of any party of any ilk to be able to do something like that. And I think the public should be very aware of those obstacles, those problems that are going to be in front of us while we're doing this work, because that's what the budget is. That the budget is us saying at this moment in time on this piece of paper, these are how our numbers balance out. But remember, this is all based on estimates. It's not money the state has cash in hand. It's money we estimate based on historic information we believe we will bring in over the course of the year, and based on data that we currently have, what we believe we will need to expend over the course of the year. The original last year's budget that was made in May had no way of knowing that we were going to have an economic shutdown halfway through our budget year. And so we're just going to have to do the best we can.
Oh, I agree. I know that, for example, here at Cook County, we have our chief financial officers looking at best and worst case scenarios of how our budget situation is going to befall the county. And I know we've got a lot of bright minds working really hard to ensure that we continue to meet the needs of the residents here in the county. I know these are difficult times for not just local governments, but local businesses as well. And I see that we just got a question in from Mike. And first and foremost, I recognize your pain. Mike's a massage therapist. His office has now been shut down since March 17th, anticipating that this will likely go through June 1st with the latest shelter-in-place orders in place. And the question is about a lack of testing and really wanting a C19 and an antibody test. So I know I discussed that a little bit earlier. There are COVID-19 testing sites online here in the Northwest suburbs in the 15th district. There's a lot of sites throughout Cook County, and more sites are continuously going online. If you feel the need to get a COVID-19 test, please call those locations. I mentioned earlier, if you go to the Department of Public Health here in Illinois' website, you will be able to locate where those sites are and call in and find information of how you could potentially get a test. Right now, I'm hoping that we have more antibody testing go online as well. I hear your want for that as well. I want to be tested for antibodies. I had been at a conference in late February, and none of us know since latest projections are that this may have been circulating already in the Chicagoland area in mid-February. How many of us may have already come in contact with this virus and have recovered? And I know that information soon hopefully will be coming online, and hopefully there'll be more opportunities for antibody testing. I know that there is a location in Schaumburg that is beginning to do that, but the amount of people who have already signed up to get that test, there's already weeks on a waiting list. So hopefully we'll be seeing more of these antibody testing sites go online throughout the county and in the area. And so I hope that you do look at the resources. I know that the federal government recently voted on more funding towards the PPP loan program from the federal government. I hope you look at the Cook County Community Recovery Fund, which is giving those rapid relief loans up to $20,000 for small businesses here in Cook County. There are a lot of resources where you might be able to help keep things at bay as we continue with the shelter-in-place orders and having certain types of businesses having to remain closed. And so I hope you will continue communicating with my office, and we'll be happy to share any of those resources that may be applicable to your business. And hopefully you're able to get testing here in the near term in the tune of the antibody testing.
I think the next question is yours too, Kevin, because they're asking about increased access to bikes and pedestrians in the forest preserve, and that would be you.
Restricted access to forest preserve trails and parking lots has been. All right, very good. So I hope this answers your question. I know that there was some updates in terms of the Northwest suburbs with some of the access to our forest preserve districts here in the Northwest suburbs. I was not. I had several conversations like this yesterday because the news came out quite late in the afternoon, and I had been speaking, especially as it comes with Bussy, the move was to limit parking abilities at the forest preserves around Bussy Woods. And I know that there were a lot of concerns. I think where it was coming from with some neighboring counties closing their forest preserve districts, we were seeing an influx of individuals into our forest preserves. And the fear is, how do we continue keeping the forest preserves open while people are able to maintain appropriate social distancing? The hope is to keep separate households away from one another at this time, because we don't want to see this disease continuing to spread. And so I know that there are a lot of conversations going on with the local surrounding municipalities and the Forest Preserve District and our Superintendent Arnold Randall to try to find a good resolution. I believe that after some of the changes that were implemented this weekend, there's going to be a reevaluation on Monday on how to proceed moving further. And so the part of the question was about repurposing roads to allow for greater access for pedestrians and cyclists. I don't know if I'm fully understanding your question, but if you mean like surrounding areas outside the forest preserve, okay. Sorry, I saw another question come in. I apologize. I know that at least in terms of the trails, it's unfortunately, people have to maintain appropriate social distancing while still utilizing those. I'm sure that with the parking lots closed off, especially, through some of those arteries in Bussy Woods, of course, you may be able to utilize those streets that are located there in terms of biking and walking as well, to keep further if there's an influx of folks on the paths themselves. So hopefully that helps answer your question. We're going to be continuously trying to provide more information as it becomes available. And so hopefully we can get more information posted to our social media and included into our newsletter as well. And we'll try to get more information about changes with the Forest Preserve District. And then we had a question about golf. I believe I had that in my email. Governor J.B. Pritzker is facing more questions about whether he will allow certain outdoor recreational sports, including golf courses and state parks, to reopen as the weather improves. With the state stay-at-home order extended until May 30th, the governor says it's critical to continue practicing social distancing, but that he is considering making some changes to COVID-19 restrictions to allow for more outdoor activities. The question was, when will golf courses open back up? Have you been hearing any more information from the state? Oh, I think she's getting pulled away. I know that there is going to be some updates in terms of outdoor recreational activity updates in the near future. Representative, have you heard any word on when potentially outdoor golf may be able to resume?
So under the recent executive order that came out, our guidelines indicate that after May 1st, golf will be permitted under strict safety guidelines provided by the Illinois Department of Commerce and Economic Opportunity, so that they can ensure that social distancing is being followed. So I imagine in the next 2 weeks, you will probably see more information about that. I imagine it's not going to be every kind of facility that is able to open, because again, I think a lot depends on your ability to social distance. And remember, it's not just the players on the field. I think it's a question, that they would be able to social distance. It's also the vast number of employees that you see having to interact behind the scenes, I think to maintain the grounds and maintain the equipment. And I'm not a golfer. I don't know all those pieces, but I know that's part of the problem. Like even when we talk about the state parks, they sound so vast. It seems like people are not going to have a problem separating from each other. But again, part of the problem is actually the staff that works behind the scenes and their ability to stay protected from each other, the handling of other equipment. I know that I've heard that there are golf courses that are open in other states that have placed severe restrictions on not being allowed to touch the flag. They're not even really letting you put the ball in the hole, apparently. And I think that there are restrictions on being able to use golf carts, or maybe whether or not caddies are allowed to touch your equipment. So I would say stay tuned.
Awesome. Let's see if we have any other questions coming in.
Okay. I think there's just a bit of an exchange going on.
Yeah.
So I would say part of it too is you want to continue to stay in contact with both of us about what your experiences are day to day. You know, again, we want to try and gather information about how things are going, whether it's education, whether it's access to food, whether it's, you know, your access to the unemployment, so that we can take this in and try and make plans that will work better going forward. Certainly, you know that it's possible that we are trying to prepare for the concept that we may see a resurgence in the fall, as often happens with these kinds of things, and that if it's combined with the flu, that could continue to complicate things. You may see other restrictions or social distancing, or having to come back with masks and gloves again. But again, the more we know about what people's day-to-day experiences are, the better we can help plan for should this happen again in the future.
Thank you so much for that, Representative. Awesome. So as of right now, I'm not seeing any more questions come in, but since we do have a little bit more time, I will give an update from, oh, let's see, from Debbie. I just got a ping. It went through my cell phone though. Okay, all right, awesome. Sorry about that. So in Cook County, right now, the treasurer has postponed indefinitely the auction of delinquent Cook County property taxes. The clerk's office has suspended collecting delinquent taxes until further notice. The circuit court proceedings are being live streamed for certain courthouse via YouTube. Many criminal and civil cases have been postponed through May 18th. The assessor will be considering an adjustment to property assessments as a result of the COVID-19 pandemic. So those updates are to come. The Forest Preserve District of Cook County has closed some locations and parking lots where people were gathering in groups. They've also closed all public restrooms and put up signs encouraging social distancing and use of face coverings. Brookfield Zoo and Botanic Garden are both closed to the public. If you want something fun to watch while you're staying from home, look up Bring the Zoo to You. Their chat live on their Facebook every weekday at 11 a.m. So they're opening up and doing some live stream videos at Brookfield Zoo, which is a fun way to help support those initiatives as well. I know that a lot of our museums and zoos are being hit quite hard right now, and so it's important to continue supporting them. I know a lot of folks are getting antsy during these stay-at-home orders, but for those of you who are looking for ways to give back at this time, I know a lot of us are feeling antsy at home. There is a severe need for blood donation, so please go to the American Red Cross to be able to find locations near you where you could donate critical needs for our blood reserves. Also, there are many, many volunteer opportunities. Over the past several weeks, I helped out in Hanover Township and dropped off over 90 meals to seniors throughout the northwest suburbs, so that we can make sure that they stay home, but also have the food that they need to stay well. I was actually at Trickster Art Gallery earlier this morning, helping pack some bags to go to our veterans. So that was another way I was able to help out. And I tell you, every time I have an opportunity to go out and volunteer like that, it really makes me feel so good, because a lot of times I'm just here and having really difficult conversations. You know, I've been trying to make sure that I am constantly talking with our Cook County Department of Public Health, our emergency management. I'm helping not only answer questions coming in from residents, but able to share resources and information and get better assistance to our localities. I was brought into a conversation yesterday. It is the policy right now that if at any of the, be it restaurant, grocery store, anything like that, if you are an individual who is working on the front lines, and, you know, be it food delivery or grocery and the like, it is mandated that the business owner, if there is a COVID positive case through one of the staff at that location, they have to notify you and everyone there that they may have come in contact with someone who tested positive. I had heard that one of our businesses in the northwest suburbs did not inform staff when something like that occurred. So there is an ability to submit those type of questions and reports to the Attorney General to make sure that the businesses that are remaining open are following accurate guidelines and mandates about what to communicate with their staff. So that's incredibly important. I've been working really, really hard. As everyone knows, there is a limited amount of PPE, and I am incredibly thankful for the structure here in Illinois. The governor has been working really, really hard to acquire more PPE to come into the state and helping disperse that through IEMA, through our Illinois Emergency Management Department, to be able to get that from the state level down to where it's needed most, to be it our long-term care facilities, to our municipalities, our first responders, our jails, our correctional officers. There's been a lot of great communication to be able to meet some of those PPE needs. And I'm going to continue pushing and advocating for appropriate PPE for everyone who is working today so that they can acquire and be able to protect not only themselves, but the people around them. So I've been helping and pushing on those issues as well, and have been incredibly thankful for a lot of our municipal leaders and how they've been helping not only our local businesses, but our nursing homes be able to acquire some of those needs as well. Michelle, do you have any things that you would like to throw in?
I think if we're going to talk about service to the community, especially for people who can't leave their homes, if you have the financial means, honestly, send money. So one of the things that we did find out is spring is fundraising season for a lot of your favorite charities. They hold they hold galas, they hold golf outings, they hold luncheons, all sorts of things that really got interrupted. So if you have a place in your heart for domestic violence victims, for abused children, for people with disabilities, organizations like Wings, like Clearbrook, like Little City, like the Children's Home and Aid, any number of organizations really have kind of been thrown for a loop, and they are still by necessity absolutely caring for these very, very vulnerable people. Our homeless advocates, any of them, send them $5. It's a small amount for you. It will add up for them. And you will feel that you did in some way contribute to the work that they are doing. If you were going to go to the gala anyway, send them the money for your ticket, if that's possible. I know it's a really hard time right now when everyone is very unsure of what their financial future looks like. And I know that is a lot to ask. But if you are able, I certainly encourage you to do that. I do encourage you as best as possible to look out for your neighbors. We know that families are experiencing incredibly high levels of anxiety and depression, and that can exacerbate domestic violence situations. And it can be very hard to call for help or leave if you and the abuser are in the house at the same time all the time. There's no ability to sneak out. So please look out for each other. Please know that help is available. Know that you can call 911. Know that your local police department can connect you to Wings and other service providers that will see you sheltered in a hotel so that you do not have to worry about being exposed in a congregate setting. We know too, look out for each other as parents. Again, this is an unprecedented time of stress. And the calls to our DCFS hotline have dropped dramatically, even though we know that abuse is likely continuing to go on or be exacerbated. So certainly neglect or hunger, any number of problems may be going on. So we encourage you, if you are feeling stressed, it is really, really normal. And you should just call for help. You admit that we all need to just ask for help when we need help. And know that, again, these things are going to send reverberations through our community for a very long time. And we will work together to help each other heal through that. But those are things that I just want people to have in the back of their minds. And for everybody who's, again, trying to help inspire the community, for everybody who's putting happy things on Facebook and other places to inspire, for everybody who put a little chalk design in their driveway that we can see when we're walking around, or a teddy bear in the window. Thank you. Keep it up. So thank you, everybody.
Awesome. And there's a couple last things that I would like to throw out there. There's another incredible program that the county has moved forward on, and it's continuously growing in terms of who it's applicable to. It began, we are now doing respite housing, and we have been able to acquire hotel rooms throughout the county for folks who have COVID-19 and have tested positive, but have at-risk family members or are afraid of potentially bringing it back to their homes if they live with other folks. What the county is doing is for people who do not need to be hospitalized, they're providing hotel rooms for folks as they recover so that they don't potentially spread it to their families. And that's an incredibly important initiative. We just expanded that program this week to include medical workers, first responders, correctional officers. So folks who are working on the front lines who may be coming in contact with folks who are COVID positive and are fearful about potentially bringing that back home. You can ask and be able to receive more information from Cook County's Department of Public Health's hotline or their email address on respite housing initiatives to be able to get a hotel room. Again, that number was 708-633-3319, or you can email ccdph.covid19@cookcountyhhs.org. And as Michelle was saying, it is incredibly important at this time to be able to support our nonprofits, our local organizations who are giving back right now. I'm going to give a major shout out to our food pantries. A lot of them are not able to receive the same donations they were before this initiative took hold. And there's so many folks who are desperately relying on our food banks to get food for their families. And so if you're able to donate money to your local food banks here in the 15th district, you can write a check to Schaumburg Township, Hanover Township. All of our local food banks out here really could use the support. If you hoarded way more food than you're going to be able to eat all year and you want to make a donation of some canned goods and non-perishables to your local food banks, they're also receiving those as well. We're continuously updating the information of how you can make those contributions, and we're going to continue sharing that information. But right now, I know it's a hard time for all of us. I know we're living through this together, and sometimes it's really hard for us to deal with the stress and all those added emotions that are falling on us. But I want you to know that I strongly believe and I'm grateful for the local leadership we have here in the Northwest suburbs. We are all working really hard to try not only to get through this, but I firmly believe that we will be stronger once we do. I want to thank everyone who came and spent some time listening to this live stream. I hope it was informative and helpful. If any other questions come in, if you hear of any issues that we should be aware of, be it a landlord trying to forcibly evict at this time, be it a manager at a business not following guidance, be it an issue at a local nursing home, please reach out to our offices and we will make sure to notify the appropriate response teams to help deal with that situation. We want to be of assistance right now. We want to make sure we are linking you to the resources as they become available. So please continue reaching out and posing your questions to us. And I really thank you for this time.
I think we're experiencing technical difficulties.
Uh-oh.
Or at least on my end. It looks like Kevin's a little jumpy.
Uh-oh. Was I clear enough with what I said, or was it completely jumbled?
Okay. Well, maybe that falls on me. Kevin froze on my screen. I don't know if he froze on your screen also. Okay. Well, I have groceries to go deliver. There's a line of cars outside, and I'm going to put on some safety equipment and get moving to help my seniors. So I want to say thank you to everyone. Thank you to Kevin. Thank you to all his staff for putting this together. And I'm going to go ahead and jump off this call. I look forward to seeing everybody again. Thanks.
Thank you so much, Representative. Thank you all. Be safe and healthy out there.